My name's Katrina Milaney, and I'm an assistant professor in community rehabilitation and disability studies in the Cummings School of Medicine. So I've been with the University of Calgary for 3.5 years, and before that I spent a number of years working in community-based organizations as a researcher. And so I've spent a number of years working in the homelessness sector, primarily with women and children and some adult singles, but primarily in the area of homelessness. My interests really are less about what do we need to do differently for people, and more about how do we look at what is happening in our public systems and where the barriers are and the gaps in services for people, and seeing if there's anything we can do to change that. I think research to be most relevant needs to be done in the community and with community. And so all of my projects, I try to partner with different organizations that are working frontline, try to engage as many people with lived experiences as we can, because that's, I think, where change happens. And it happens in community because that's where the work is and that's where the people are. And so when we look at our public systems and when we look at our public policies, I personally want to hear from people who are navigating their way through those systems every single day to help me understand what role can I play as a researcher, first to uncover those issues, but then to work collaboratively with our community partners to think about alternatives or to think about solutions. So really the idea behind this type of research is how do we make change in some way? So 2 years ago, we partnered with In From the Cold and the YWCA. We were interested in understanding the relationship between domestic violence and family homelessness. So what we knew is that it is a risk factor, that many families in shelter are fleeing violence. So we wanted to understand how many and what that experience looked like. And what we found is actually that every family that we met had experienced violence in some form. And a lot of the moms that we talked to had multiple abusers over their lives, starting in childhood and then into adult relationships. But what was really surprising to us was the number of newcomer moms who volunteered to participate in our study. And what we found in talking to those moms is their experiences of violence are quite different than what we know here in Canada. Many women have had terrible experiences in their home country at the hands of people in authority. And so that was a key learning for us, because we need to think about how do we respond then to women who have had multiple abusers over the course of their entire lives. And so that project really, as often happens in research projects, brings up more questions than answers. And so we really want to keep moving forward on this issue around family homelessness and trying to understand what are some of the other risk factors and what are the issues that these moms are facing in trying to navigate their way through these multiple systems. So like I said, the previous research we did brought up new questions for us. And so what we decided to do was focus primarily on newcomer moms. And so we've engaged a few moms already in some interviews, and we're going to talk to quite a few more over the next few months and next few weeks. And we've partnered with the Women and Children subgroup of the Calgary Recovery Services Task Force, of which the Inn is a partner, to help us with that project. And so we know that there are lots of refugee families and immigrant families in our shelters. About 30% on any given day are from other countries. And so this is problematic because the moms that we've talked to so far tell lots of stories about how things have actually gotten worse for them since they've come to Canada. And so this is troubling, given that we are an open country and we are welcoming so many families and so many people from around the world, which we should be doing. It's really important. But it's a bit of a tragedy when those families come here for a better life and their only option is emergency shelter. And so what we're finding is lots of gaps between the immigration system, the settlement system, the housing system, the healthcare system, the social assistance system. So these moms, in addition to dealing with the daily stresses of parenting and homelessness, are also caught between these big systems that are really hard to navigate. So we're going to spend the next couple of years looking at the policies and the processes, the documents and the experiences of people who are in those systems to try and figure out if there's a better way. So I think our goal always going into projects like this is to think about what can we do better. So we live in a place, I think, that is full of opportunity, and there are lots of resources that we can and should be accessing. But I think we need to do a better job in helping understand where those systems sometimes fall apart. And so by looking at the policies, the immigration policies at the federal level, by looking at our provincial healthcare policies, eligibility criteria for affordable housing, and social assistance programs, that will tell us a lot about where these moms are falling through the cracks. And so we hope to be able to create a visual representation of the system from the time that moms and their kids get to Canada until the time they end up in emergency shelter, and to show the different points in the system where it has broken down for these families. So if we can do that, then we can make some recommendations for how those policies can be changed. I think our systems can break down in a number of places, and one of the things that we're learning in this study is that coming here with a particular type of refugee status or newcomer status is not a guarantee that you will get the supports that you need. And so lots of the moms that we've been talking to, because they are fleeing violence in a lot of situations, they lose their status because they're fleeing a violent situation, or their sponsor pulls back on their promise for sponsorship. And so they're kind of trapped, not being able to prove their status, not having the right ID. The legal system in Canada is also, it's complex, but it's also very different if you're coming from another country. And so trying to figure out who to even talk to get legal support, whether it's for custody, to understand your status, to figure out when your court date is a really complex issue. The other issue that a lot of these moms are dealing with on a daily basis is fear. And that fear is fear of losing their children. Because they are homeless, so fear of child welfare intervention. If they're fleeing violence, that's another fear. And a lot of these moms, because they have had multiple abusers, for some of these moms, it's difficult for them to develop trusting relationships and to know who to trust and who to talk to. And so getting good information is one really big barrier. So my hope is always that we will have an audience that is interested in our learnings and our recommendations. Because we have multiple partners engaged from the start, I think that helps. So we have representation from the immigrant settlement sector, from homeless shelters, from the provincial government, and from the city, who are helping us think through, what does all of this mean? So we're collecting these stories from the moms. We're picking up on these gaps in the policies between immigration and health, for example. But really, we want them to help us think about what does it mean? What are the implications of these issues? And can you help us think strategically about a way we can do this better? So my hope is at the end of this project, we'll come out with a number of recommendations that our recovery task force can then take up in terms of advocacy, trying to influence changes to policy, potentially enhancing service delivery in shelter for these families who are kind of trapped in these systems. So building some expertise around the legal system, the immigration system, so that these moms know where to go to get a form filled out or to find out when their court date is. That would be one example.